Hello everybody, myself Dr. Shabana. I am consultant nephrologist and transplant physician. Presently I am going to talk about the kidney diseases. As we are aware that we have the two kidneys and our function of the kidneys is to remove the waste material from our body and to help in the maintenance of the blood pressure and help in the maintenance of the acid-base balances. That is whatever acid-base balances is there, that will be maintained with the help of our kidneys. And it also helps in the maintenance of the sodium maintenance, potassium maintenance. Then coming to the what are the kidney diseases? Are the kidney diseases common in our society or in our community? Coming to the there are different types of the kidney disease. It can be like chronic kidney disease where your kidneys are permanently not functioning, and coming to the other type of diseases like AKI, that is acute kidney injury, where your kidneys that is temporarily is not functioning అంటే తాత్కాలికంగా అది కిడ్నీ పనిచేయకపోవడం. It might be because of AKI, that is where temporary kidney is not functioning. It might be because of loss of blood, or there may be infection in our body. Suppose somebody has met with an accident and there is a profuse loss of the blood in the body. So that will leads to what happens is that will leads to the decrease in the blood pressure. So decreased perfusion of the kidneys, which in turn will lead to the decreased functioning of the kidneys, and that will lead to the acute kidney injury where your kidneys will be temporarily not functioning. So proper treatment and correct identification and knowing the correct cause of the AKI will help you to recover your kidneys, and this AKI can be stopped. And if we give the proper treatment, then AKI will respond. Then there will be no permanent loss. But some patients, if they are not in, if they did not get the correct treatment of AKI, or if did not reach the doctors or the treating physicians in the correct time, then that disease can progress to the chronic kidney diseases. Then coming to other type like as I already told you, CKD, AKI, then nephrotic syndromes. Nephrotic syndromes is mostly common in the children. Until there, the children are below 11 years, or sometimes in adults also, there will be the swelling of the face and they will be losing the proteins in the urine. That is called as a nephrotic syndrome. And then coming to other diseases like the kidney stone diseases, or it can be kidney cyst diseases, or some diseases run in the family. Then today's topic is chronic kidney disease. It means that you are suffering with the kidney disease chronically. That means there is a decrease in the functioning of the kidney from more than 3 months. Then how do you come to know whether you are suffering with the kidney diseases? Is there any test? Is there any symptoms? Do the patients with the chronic kidney disease will get any symptoms? Then coming to that, this is a silent killer. Chronic kidney disease is a silent killer. It means that suppose if patient has a chest pain or patient has shortness of the breath, then then we'll know that patient has the heart attack. So there are the symptoms of heart attack. That is coronary artery disease has certain symptoms, and then we'll think that the patient is suffering with the heart attack. But whereas coming to the chronic kidney diseases and kidney diseases, most of the time is a silent killer. That is chapa kinda neer laga, more than 50% functioning loss అయినంత వరకు kidney diseases will not be screened, will not be come to diagnose. So this is the most disadvantage, that it is a silent killer. It does not show you the more symptoms until your functioning of the kidney is lost more than 50%. So, is our responsibility or is our duty to know about the chronic kidney disease? Is it so common? Yes, it is. It has become one of the most common kidney disease, one of the chronic diseases, that is non-communicable disease. It's chronic kidney disease has become the one of the most common diseases. What are the causes and what leads to the chronic kidney diseases? So the study says that most common conditions like patient has because of the lifestyle changes. Today's life, because of lifestyle changes, we are suffering with the most of the patients, most of the people are suffering with the diabetes, hypertension, and heart attacks, and lipid changes and all those things. So the susceptible risk factors to get the chronic kidney disease, who are at risk factors, is like the people with the diabetes, people with the hypertension, or people with the family history of the kidney diseases. They are at the risk to get the chronic kidney diseases. And few studies says that 1 in 3 patients of diabetes are suffering with the chronic kidney disease. 1 in 5 patients of hypertension are suffering with the chronic kidney diseases. Then what are the early signs? Early signs will be there or not. Early symptoms will be there or not. As I said that when there is a more than 50% loss of the chronic kidney disease, kidney functioning, that time you will get the signs. But few are the few early signs like nausea, and then passing more urine in the night, nocturia, and sometimes there is a decrease in appetite, and sometimes if patients are lucky, they will get the symptoms like puffiness of the face and the pedal edema. But when there is when there is your functioning of the kidney is lost more than 50%, that time you will get the symptoms like the pedal edema, puffiness of the face, and generalized swelling, then decrease urine output, then you will get decreased appetite, nausea, vomitings, and the features, signs will be like patient will be anemic, decrease ability to work is decreased. So all these are the symptoms. Then what is the investigations? How can you know that patient is suffering with the kidney diseases? There are two simple tests which will tell you the status of your kidneys. Suppose if you are diabetic, if you are hypertensive, it's better to check the blood test and urine test. That is, in urine test you will see whether you are losing any proteins in the urine or not. Then in blood test you will do one simple test, that is the kidney function test, that is RFT, renal function test. In that renal function test, we will see whether your creatinine, blood urea, uric acid, electrolytes are normal or not. And the risk factors, patients like diabetes and hypertension, at least they should go for screening at least once in a year, so that we'll come to know what is your status of the kidneys. Because as I said, that 1 in 3 diabetic patients are more susceptible, and they are suffering with the chronic kidney diseases. Then coming to the what are the treatment modalities of the chronic kidney diseases. So chronic kidney disease, there are certain guidelines which will classify the chronic kidney disease into the 5 classes, that is class 1, class 2, class 3, class 4, class 5. Should I know all these classes? Is it important for me, for a common people, to know the classes? It will help you to know that what is your present status and how long you can be on the treatment, and how long you can postpone the dialysis, and how long you should be careful, and you should maintain your blood BP and diabetes in the control, that is normal range levels. Then stages, as I said, it divides it depending upon the EGFR, what we call as an EGFR, that is calculated glomerular filtration rate. That will tell you the percentage of functioning of the kidney. It's an online calculator. Your treating physician will check your EGFR, and he will tell you that your kidney is functioning 30%, 60%. That means, suppose if it is actually normal, should be more than 90%. If it is less than 90%, then if it is less than 60%, or if it is less than 29%, or it is less than 15%. Then we coming to the class 5, there where your kidneys are functioning less than 15%, but still patient is not will not push the patient to the dialysis until they have the symptoms like fluid overload, that is a decreased urine output, or SOB. All those things will decide the factors into non-dialysis and dialysis on the stage 5. So is it stage 5 similar to the cancer stage, that is last stage? It's not like that. This staging will help you at what percentage your kidneys are functioning, and what the treatment modalities will vary depending upon your staging. So you should know about the staging, and you should, if you are diabetic and hypertensive, it's better to screen the kidney diseases. Just do the 2 simple tests like the, as I said, creatinine and 1 urine test to check whether you are losing proteins or not. You can just speak to your treating physician. Can I go annually for this test? Yes, you have to go annually for this test, so that you can prevent the chronic kidney disease. Coming to the treatment modalities, we have this dialysis and the transplantation. Actually, dialysis is only the supportive treatment. Suppose if your urea or blood urea and creatinine is very high, and you are in stage 5, and you have all the symptoms, as I said, like fluid overload, decreased appetite, decreased urine output, and severe anemia, severe acidosis, all these things, then that time will suggest, your nephrologist will suggest you that it's better, this is the correct time you should go for the dialysis. So dialysis is like, it's an only supportive treatment, it's not a complete treatment of the chronic kidney disease. Then what is a complete treatment? Complete treatment is a transplantation. That is, we have to go for the transplantation if your kidneys are not functioning, and you are on the end stage renal disease. And then transplantation, again, it's of 2 types. It can be life related, or it can be disease related. Disease related means, suppose if you are enrolled, as in our Telangana, we have a program called as in Jeevan Dan. If you are enrolled in the Jeevan Dan, then you will get the according to your points, your name will be enrolled in the Jeevan Dan. And suppose if some patient of anyone who has died in the RTA, that is road traffic accident, or he or she is willing to donate the kidneys, if your name is on the top list, then you will get the elected, and you will be selected, and you will get the kidney from that patient. from the disease. Then coming to the life related transplant is like your near related relatives, like your, it may be your mother, father, may be your brothers, sisters, or it may be your wife or husband, or it may be your mother, grandfather, or grandchildren who are willing to donate your kidney with love and affection, and who are your near relatives can give and come forward for the life related and transplantation, so that your kidneys will be replaced with the functioning kidney, and so that you can survive longer. And at the last, I just want to tell you that chronic kidney disease is a chronic disease, and it's a silent killer. So it's better, as we know, the population, because of our lifestyle changes, the most of the people around 40 years are also suffering with the diabetes and hypertension. So the people who are with the diabetes, hypertension, are who have the family history of the kidney stones, or who have the family history of the kidney diseases, or who have the cyst in the kidneys in their family, it's better to screen yourself. And if you are more than 40 years, at least go for the annual screening. That is annual screening, you can go with the two simple tests. As I said, it's a one blood test and the urine test. Check your creatinine, check whether you are losing any proteins in the urine. That will help you